I'm Dr. Matt Krolikowski. I'm here with the Department of Internal Medicine and also infectious disease. I work primarily in the hospital, but also here in the clinic about 2 days a week, seeing hospital follow-ups and new patients that are sent to me with infectious disease cases. I became a doctor because I'm a terrible writer. That's the short answer. The long answer is the usual. I wanted to help people. Both parents are in healthcare, and I just took the next step and went on to be a doctor. I chose my specialty because I love infectious disease. It's the last great specialty in medicine. You get to see from head to toe. You know, the heart doctor gets to say, no, it's not your heart, bye. I have to think, okay, you know, where did you go? What did you do? I have to know everything, a little bit about everything. I say it's like the Jeopardy of medicine. So a lot of trivia that is immediately important to taking care of somebody. The most rewarding part of my job is a right diagnosis. Part of infectious, or the biggest part of infectious disease is figuring out what's going on when nobody else can. And so being able to tell somebody it's this bacteria, it's this virus, it came from water, it came from your dog, being able to tie all the pieces together in one nice package for a patient is great. The overarching goals for my patients are that I never have to see you again. That's always the best part of infectious disease, is I know I've done my job if I never have any patients, because my goal is to get them cured of their infection and on their way to hopefully never need me again. So my ideal day of work would be being able to make a diagnosis quickly, getting the patient turned around who's, you know, septic shock in the ICU, and pull them back from the brink and feeling better. Get the grandpa talking to the grandkids again, you know, just generally helping people improve quickly and figuring out what's going on to make the right diagnosis. My background helps me out in seeing patients because I actually have a BA in English, and so I'm not your typical biology, medical school, etc. I started as a writer, as I suggested earlier, and so I have impeccable spelling. But my notes, you know, documentation is a big part of medicine. It's about 50% of the job. And so, plus having an English major background, a lot of it was in journalism, so interviewing people. And so, you know, knowing how to conduct an interview with someone and ask the questions I need answered, pick up on the subtleties in the conversation that somebody else might miss is always a big part. I love Northeast Tennessee. The whole reason I came here was because I never wanted to see snow again. So I still get, you know, a little bit of a taste now and then, a little bit of dusting. I think last year we had a couple inches that lasted for a day or so, and that was it. So that's perfect, but I love the area. It's beautiful. It's not overdeveloped like Philadelphia, where I lived before. People are always really friendly, and it's just a beautiful area. I'm Dr. Matt. Thanks for spending some time with me. We'll see you at my ETSU Health Clinic.